Understanding postpartum depression and how to deal with it. Postpartum depression is an illness with biological and psychological components and may occur in any woman who has recently given birth or adopted a child, regardless of age or history of mental health problems. The symptoms include feelings of sadness, hopelessness, and anxiety, changes in eating habits, weight loss or weight gain, loss of interest in activities once enjoyed, restlessness or irritability. To diagnose postpartum depression, the gynecologist may request that you undergo a specific screening that involves answering a series of questions. In many cases, hospitals and healthcare facilities will use the Edinburgh Postnatal Depression Scale, EPDS, to evaluate your postpartum depression. The gynecologist may also order a blood test to eliminate other possible causes of your depression, such as thyroid disease. Both are necessary to ensure that you are given the correct diagnosis. Depending on the test results, the severity of your postpartum depression can be divided into three major categories. Postpartum blues. This depression is standard and can occur within the first few weeks after birth. It may last a couple of days or up to 2 weeks. Some women have minimal symptoms, while others experience crying spells, mood swings, and exhaustion. Some women feel like they're not bonding with their baby as much as they should be and may seem more irritable than usual. Postpartum depression. From baby blues to full-fledged depression, the second type of this condition affects about 1 in 7 mothers. The rate increases by 30% for women who've undergone previous episodes. For this category, you may experience more severe symptoms relating to irritability, fatigue, inability to care for the baby, and extreme highs and lows. Postpartum psychosis. The symptoms of postpartum psychosis often appear immediately after giving birth and can last up to several months. Some of the symptoms include paranoia, confusion, agitation, insomnia, hyperactivity, feelings of shame or hopelessness, and mania or rapid speech. People who experience postpartum psychosis are at a higher risk of suicide and causing harm to the baby. The treatment and postpartum recovery may vary depending on your needs and the level of your depression. In some cases, medication can help treat postpartum depression. If you have underlying conditions, this may also affect the treatment process. But to give you a better idea, here are some treatments your gynecologist may propose. Psychotherapy. Here, you will be required to share your concerns and symptoms with a psychiatrist or mental health professional. Then, through continuous sessions, you can find better coping mechanisms to sort your feelings, solve problems, respond to situations positively, and set realistic goals. Antidepressants. If you're experiencing anxiety, stress, and extreme loneliness, the gynecologist may also prescribe antidepressants. But take note, if you are taking antidepressants while breastfeeding, the medication may affect your milk production. Medication. For more severe types of depression, doctors may prescribe a combination of medications. Examples of this include antipsychotic medications, benzodiazepines, and mood stabilizers. These types of medication function to regulate your symptoms and prevent potential breakdowns. Electroconvulsive therapy. However, if medication is not enough, your gynecologist may recommend that you undergo electroconvulsive therapy, ECT. This procedure passes small electrical currents to your brain to intentionally trigger a brief seizure. The impact of ECT will change your brain chemistry and hopefully lessen the symptoms of your depression or psychosis.